In the 72 years since the NHS was founded, no generation of staff has had to cope with a pandemic like COVID.
We're under a lot of pressure every day now.
Overstretched, understaffed and battling a virus unknown to medicine just a year ago.
One of my colleagues left in tears because it's been such a horrendous night.
They've borne witness to unimaginable pain and suffering.
There's people like me that are going to be looking after you when you're at your lowest.
Today, MPs on the Health Select Committee started gathering evidence about that toll and its potential impact on them.
Doctors subject to very high levels of work demands chronically are between 45 and 63% more likely to make a major medical error in the subsequent 3 months.
Even before the pandemic, there were warnings that job stress, anxiety and mental illness were causing doctors and nurses to burn out. Charlie works as an anaesthetist. Despite his passion to help patients, he still found it overwhelming at times and had to seek help.
The worst feeling as a doctor, you train so hard to be there for people, and when you physically can't be there because your mental state just can't take it, it's a horrendous feeling and it spirals out of control. I felt taking control of small things like my diet, like my sleep, like a bit of meditation, mindfulness, things like that. It just meant that there was at least some areas of my life that I was in control of. And I'd say that to my friends and colleagues now, is if you can take control of little areas and feel that control somewhere, then actually the lack of control you have at work doesn't have such a big effect on you.
After seeing her husband and friends struggle, Harriet set up a charity, Duty to Care, to connect NHS staff with well-being practitioners, from psychotherapists to personal trainers, for free.
I think that a doctor has to go through all sorts of different things on a normal day and a regular shift, and they have to come home and turn themselves around and go back in the next day. And if something's sort of chipping away at them over the course of time that then leads them to dropping out after years and years of training, it's not just the financial investment, it's the emotional investment, and it's incredibly upsetting to think that we're losing the best people and we could have prevented that.
Unless the old attitude of physician, heal thyself is rooted out and support like this provided without stigma for those burning out, their colleagues will find themselves under even greater pressure. Vincent McAviney, 5 News.